Hello, hello. Melanie here, coming at you today with another edition of Off the Mat. And today I'm going to give you a Women's History Month health guide. Questions to ask and tests to know about the next time you go to the doctor. It is March of 2026 at the time that I'm filming this video, and March is one of my absolute favorite months of the year. I celebrate my business anniversary, it's peak college basketball season, we are heading towards spring, the weather gets brighter, the days get longer, the sun gets sunnier. You know, it seems like our moods and our spirits just lift a whole lot more and things just get a little lighter in March. Along with all those things, March is when we celebrate Women's History Month. We celebrate the strength, the resilience, and the achievement of women. We take time to support women-owned businesses, further our understanding of causes that directly affect women like voting rights and access to reproductive care. So with this in mind, I thought it would be the perfect opportunity to talk about women's health. So the focus of my business, Moves with Melanie, and a lot of the emphasis that I place right here on my channel is for women in their 30s, 40s, and 50s, helping you tap into what makes you you. Creating those sustainable habits, creating the life that you really love living, and just taking yourself from where you are to where you want to be. And one way you can do that is feeling empowered when you go to the doctor's office. How many times have you gone to the doctor and felt like you have not been heard, the appointments felt rushed, and you end up leaving the appointment with more questions than answers, more anxiety than clarity, and you frankly are just more frustrated than you were 15 minutes ago before the start of the appointment. So my first tip for you is to prepare for the appointment in advance. Doctor visits are often short. A lot of times they're 15, 20 minutes max. So you really want to make the most of that time that you have one-on-one with your provider. So what do I mean by preparing in advance? Write things down either in a note on your phone or a handwritten piece of paper like I would do and bring it with you to the appointment. What are some things that you need to write down? Changes in your energy level, sleep pattern, hair texture. Are you losing hair? Is it growing? Shifts in your weight, aches and pains, sleep pattern, anything that's come up in conversation with your girlfriends about supplements, about diets, just anything that you want answers to, write it down and bring it with you to your doctor so you can discuss it one-on-one during the appointment. Rather than trying to remember things on the spot and spending most of the appointment going, I don't know. You have done your homework in advance and you can just give the information to the doctor and they will appreciate it because it helps them stay organized as well and helps them make the most of their time too. So tip number 2 would be to obtain baseline blood work from your primary care doctor, ideally once a year as your insurance allows. This helps you, again, provide those baseline numbers and see what adjustments need to be made, if any, to your medications, to your dietary regimen, to your sleep patterns. It just gives you a foundation to go from instead of guessing, and making changes all willy-nilly. So recommended labs that I would recommend getting are your basic metabolic panel, your liver function test, your thyroid function test, cholesterol panel. Your blood pressure should be checked both in the doctor's office, and ideally you should be checking it at home as well because your numbers are going to be different in the doctor's office versus at home, as well as your vitamin D, your calcium, and your B12 levels. That's just going to give you an overall well-rounded picture of where you are today, and if things need to be adjusted, tweaked, modified, or stay the same, at least you have numbers to reference and go from. Your baseline blood work should be obtained by your primary care provider, and in addition to that, you should also have a yearly visit to your OBGYN. A visit to your OBGYN allows you to take a deeper dive into issues specifically related to women's health. Your pap smear, your manual breast exam, and your mammogram if you're over the age of 40. Along with those tests, you're able to talk about things that you may not feel comfortable sharing with your primary care provider. Things like sexual health. Do you have the desire to have sex? Does it feel comfortable or uncomfortable when you have sex? Your menstrual cycle. Are you cramping abnormally? Is your flow really heavy or really light? Are you noticing any spotty changes in your flow? Along with your bladder and your digestive function. In addition to those topics, this leads into my third area, and that would be making hormones a part of the conversation. Hormones play a large role in our health, and I talked about that in my last video about perimenopause and menopause. And you may benefit from getting your hormone levels tested. I know I've had to do that myself, again, in conversation with my OBGYN in regards to my menstrual cycle. I had grown up thinking that what was happening to me and my menstrual cycle and my horribly heavy flow and my horrible cramps was normal. That's the way I was raised. That's the way I was brought up. And when I said that and brought that up in conversation with my doctor was like, Melanie, that is not normal. Let's check your hormone levels and let's make some adjustments to your routine, to your regimen. And it's been a world of difference ever since. So having the conversation by just bringing it up and then getting my hormone levels tested, we were able to make adjustments, and it is like night and day for me personally. And I would love to have that same situation happen for you. So checking your estrogen levels, your progesterone levels, and your cortisol, just to start off with, go from there, see what they are, just like you would with your baseline blood work, and make adjustments as necessary. My next tip would be to be honest and share without shame. Like I've said in other videos, your doctor works for you. They get paid because you come to see them. So take the time to share what's happening with your life, what's going on. You know, it's easier to talk about things like stress and your sleep and brush it off, but things that are important to you, for example, talking about sex, that's important because you want to enjoy it when you're having sex. So talk about whether or not you have the desire to, whether it's comfortable, uncomfortable, share. Be open. Changes in your energy level. Are you just groggy and tired and sluggish all the time? Or the complete opposite. Are you wired from sunup to sundown? And is that new for you? Share. Be open, be honest, because that's the only way you're going to, one, be heard, but two, find a resolution. And my last tip for you, tip number 5, would be to leave with a clear plan. Now that seems kind of obvious, but as I've said throughout this entire video, the importance of being open and sharing and having honest communication and preparing for advance, that leads you to point number 5 and having a clear plan, because you want to leave without anxiety and clarity. So make sure you have an understanding of any new medications. Make sure all of your questions have been answered. Are you being referred to any sort of specialist? Understand the name of that person you're supposed to go to, when you're going to go, why you're going to go, adjustments to your diet or your exercise regimen, and the date of your next appointment with this provider. Have that all written down, but make sure you have a clear understanding of any next steps and the answers to any questions that you have asked during the appointment or may still have. So that's it. And I hope these 5 tips really help you out and help you feel more empowered and be proactive than reactive in your healthcare plan. Prepare for the appointment in advance, obtain your baseline blood work, talk about hormones, have open and honest communication, and have a clear understanding of your plan. You know, women's health has often been undervalued and under-researched, and a lot of times, like I said at the start of this video, our concerns are not being taken seriously. But by following these 5 steps, you'll be able to take control, take the reins, and feel empowered in regards to your health. To take a deeper dive about these 5 tips, you can read my March 2026 blog on my website. Just visit mymoveswithmelanie.com and click on the blog that says Celebrating Women's Health. And if you'd like to chat one-on-one and have that coaching and accountability in regards to your health and wellness goals, I am your health coach, I'm your pharmacist, and I would love to be there for you. Just schedule your complimentary consultation with me on my website, and we will get you moving towards your health and wellness goals. As always, thank you so much for watching, and I'll be back with more health and wellness tips very soon. Bye.